Welcome to Nursing School Explained in this video on phlebitis. So if we look at the word, phleb means vessel or blood vessel and itis is inflammation. So here we're dealing with an inflamed blood vessel, which can be a possible complication of the IV therapy. And that pertains to superficial veins as well as central veins for central lines. So signs and symptoms of superficial veins, the ones that you'll most commonly see in the patient's upper extremities, is pain and erythema, typical symptoms of inflammation. And there are three different causes. They can either be chemical, mechanical, or bacterial in nature. So a chemical is anything that irritates the vein as we're infusing it, and that can be any kind of solution or medication that we are infusing. Or it can be a medication that is insufficiently diluted and therefore kind of burns or stings the inside of the vein, and therefore the body responds with inflammation. Mechanical causes are always related to the catheter, so the movement of the catheter. And if the catheter is too large, so if you select a small hand vein, for example, and put an IV catheter in there that is just too large to accommodate that, it'll irritate the inside of that vessel wall and then cause some phlebitis. There can also be inadequate securing or movement of that IV line. So if this is in a spot like the AC where there's constant bending and moving around, or if the patient is agitated and there's a lot of movement of the IV and it's not properly secured, it moves around again in the inside of the vein and it will irritate the vein. The body responds with inflammation. And then, of course, there is bacterial causes of this inflammation, which are usually due to improper hand hygiene, cleaning when we actually insert the catheter, so not proper skin preparation, or improper cleaning of the ports, the IV ports, when we administer medication. The treatment for phlebitis is to just discontinue the IV, get rid of the causative problem, and then put a warm compress in many cases, and of course monitor the site to make sure that it's not developing into anything else like a full-blown infection. Now, how do we treat this, or what is the nursing care involved here? So the number one thing that we always need to do is assess. So every time you interact with the IV, or if there's no IV medications to be given to the patient and they just have a saline lock, then we still need to assess the site at least once a shift to make sure that it's properly working and that it actually looks okay. Flush the medicine, flush it with saline. And then, so if there is an irritating solution, we need to check, or a possibly irritating solution, the compatibility of the medications. If we're infusing two medications at the Y site and they come together at the IV port that's attached to the patient and they're irritating the veins, we need to do something about that by checking the compatibility. If it's insufficiently diluted, we can always dilute per protocol or ask our trusted pharmacist to see what they would suggest to decrease the risk of phlebitis here. Now, if the catheter is too large, you need to make sure to assess the veins of the patient properly, estimate how wide they are, and then use the appropriate gauge needle size or catheter size for that patient and the vein and the location on their extremities most of the time. Inadequate securing and movement, so we need to make sure we really tape this down, the IV down well. We secure it with some extra tape. We loop it around, make sure there's not a lot of movement going on there, even if the patient is feeding themselves, walking around, those kind of things. And then for infection or for bacterial causes, infection control is always of the utmost importance. And hand hygiene, this cannot be emphasized enough. We need to make sure we clean our hands properly. Preferably wash your hands, you know how to do that, or use hand gel, hand sanitizer, before you manipulate the patient's IV or start the IV. Now, if we insert the IV, we want to make sure we clean the site properly. Also, let that air dry, never blow on it, never fan on it. and use chlorhexidine, which is a very popular and effective anti-infective agent for skin cleaning. Now, when we do administer medication or just flush the ports, we need to make sure we clean the ports appropriately, usually with alcohol solution, and that recommendation is here for 20 seconds. So vigorous scrubbing, because remember that luer lock is like a screw, so there's a lot of tiny pieces to it, and we need to make sure we kind of get that saturated, get that twisty motion, that vigorous scrubbing to get any kind of to eliminate any kind of cross-contamination here. But always check your facility's policies and procedures to see what they are and to make sure that you adhere to those. And again, we want to let that port air dry after, and then don't cross-contaminate between medication administration and flushing the IV. So that is saline, administration of medication and saline. And I have a separate video on how to administer the medication, how to flush it. But we need to make sure that we don't inadvertently touch the hub of that port in between flushing, given the medication a different syringe, and flushing again, because that again can be cause for cross-contamination, and we need to make sure we keep our patients safe, which is one of the most important things in nursing. Please give me the thumbs up if you've liked the video. Check out the other videos in the series, also the practical videos where I actually go over on how to properly secure an IV device and other things. Thanks for watching. See you soon.